Welcome back. If you've got allergies, you're not going to like hearing this. This year's allergy season is expected to be exceptionally brutal. The Washington Post is even calling it the pollen vortex.
Don't get all watery-eyed yet, because here with symptom-soothing tips to make allergy season a lot less dreadful is Dr. Dina Kulik. Hey, Dr.
Okay, when is allergy season and begin and end? What are we looking at?
So typically it starts around March and goes till the first frost in the fall.
Is that all?
That's it. Just half the year.
Just a short season, right?
Yeah.
So, Dr. Dina, how do you know if you suffer from environmental allergies? Because I thought I was battling a cold this last few days, but one of our makeup artists diagnosed me, no disrespect to you, Dr. Dina, and said you could have allergies. How do I know the difference?
So there's lots of overlap between the two. So I think about it from head to toe. So first, allergic conjunctivitis, as we call it. Runny eyes, they're itchy, they're red. A lot of children especially will have what we call allergic shiners, so darkness or bags underneath the eyes from chronic allergy symptoms. Many kids will have runny nose, congestion, a crease across the nose as well from constantly rubbing of the nose, so it forms almost like a wrinkle across the nose. Clearing of the throat, coughing from postnasal drip. So when you're lying backwards and you're dripping to the back of the throat, it causes the clearing of the throat and the coughing. And finally, rashes, so eczema or hives are very common as well.
And does the cough sound at all barky? You know, like a seal sometimes barky bark?
Barky coughs are classically croup.
Okay, all right.
What about shortness of breath at all? Like, do you find that people end up having a little bit of a... Because last year at this time I was just giving birth, and for the first time ever, I found that I was developing asthma from allergens.
Yeah, so it is definitely possible. It sensitizes you to irritation in the lungs, though asthma and allergies go together a lot as well. And when you're pregnant, you're putting lots of pressure on your chest.
Okay.
Yeah.
So Jacek, my husband, takes antihistamines. So can you talk to us about some of the over-the-counter products that are available? And also, I find that he's resistant to taking them because it makes him not as sharp. Is that a common complaint?
Absolutely very common.
Okay.
So there are some antihistamines that are more sedating, some that are less sedating. So I think everyone can find their own antihistamine that works the best for them, ones that you take every day. There's liquid ones and chewable ones and lots of different options for kids and adults of all ages, but they can be sedating. So you can find one that's less sedating for you. But I have another approach, which is kind of head down, top down as well. So using a saline eye drop, using a saline spray for the nose will help clear the allergen from the space, so you have less symptoms, absolutely.
Okay. But a neti pot.
Absolutely, same concept, yeah. So using, salt water, clean the nose out, absolutely. Using a humidifier with eucalyptus oil, I also like a lot. And I use this for my children as well, especially my young kids. It helps to open up the airways, clear congestion, clear the runny nose. You just have to be careful with eucalyptus oil around your kids because it can be toxic if you take it in, ingest it. But using a few drops of it in the humidifier is totally safe.
So should you use it in the bathtub? Could that
that works
That's okay?
perfectly as well. Yes, absolutely.
Because I've done it, and we survived.
Yes, absolutely. Yeah, right. And another really great tip is to use a snot sucker or a nasal aspirator. So
with my husband?
You can use it with your husband. Absolutely.
That's love.
Yes, that's love. Absolutely. More classically for kids, but I guess for adults. Yeah. Okay. That's love. Absolutely. Yeah. So what you do is you put one side in the child's nose and the other side in the parent's mouth.
Yeah,
absolutely.
Person?
So we'll do it on Jen. So you literally suck out the mucus.
How do you feel? You feel clear?
You clear out? You cleared out?
This could possibly be the best first date I've ever been on.
Very personal.
You have to really love somebody.
Yes, absolutely.
To suck their snot out. That's all I'm saying.
It doesn't go in your mouth, though, right?
No. So, this part goes in your mouth, but there's a filter in between that helps to filter out the mucus. So, though you are sucking it out, it gets trapped here, so it's not as gross as you think it might be.
All right. But back in the day, I remember my mother telling us stories when we were babies that's what they used to do before we had those little sucker things. They would suck it out of your nose.
Yeah. Yeah. Or a lot of people just put their mouth.
Yeah, mouth on your nose.
Yeah.
And then,
yeah.
That's love.
This is cleaner.
You have a baby. I mean,
I would do it. I would do it.
Yeah.
I would. That's disgusting, but I would do it.
If you're not sleeping, and if the kid's not sleeping, you're not sleeping, you do anything.
Well, and you feel so bad for them too, right? Yes. They're a mess. Okay, so when would it be necessary to take prescription medication for allergies? Because that seems pretty extreme.
Right. Well, I wouldn't say this is extreme, but the prescriptions, absolutely. So it depends if your symptoms are persistent. So if it's not enough to be using the saline spray and the saline eye drops and the antihistamines, using prescriptions can be very helpful. So there are prescription eye drops, prescription steroid nasal sprays that help to decongest you and clear out the sinuses as well. There's a prescription medication from your doctor called a Leukotriene Inhibitor. It's a very complicated name for a medication similar to antihistamine that you take once a day, and it calms down the allergic response inside of you. And finally, allergy shots can also help a lot as well. So with allergy shots or immunotherapy, you're giving small amounts of the allergen over time, injectable, so that you develop tolerance or sensitization to the allergen. So so as an example, my husband was deathly allergic to bees when he was growing up. He got small, amounts of the venom injected into him regularly for 3 years. And now if he were to be stung, there'd be no reaction at all.
Oh, that's interesting.
That is a very good idea.
Okay, so,
It's like a vaccine.
It's not like a vaccine. It's the same concept.
Yeah.
You're giving a little bit of something that would normally hurt you.
but does that work for all ages? Like I'm thinking for my son, if he had them, what age is that appropriate?
So you can start any of these types of medications we're talking about, or immunotherapy, usually around age 1 or 2.
Okay.
Yeah.
Aside from medications, what are some things that people can do, like around the house, to help out this time of year?
And this is my first step. So I don't start with medications like anything.
Right.
Controlling the environment can be really helpful. So first things first, close the window. So if you keep the allergens outside, you're not going to have them inside causing you symptoms. Use the air conditioning, right? So keep the windows closed, use the air conditioning. Cleaning your physical space of anything that collects allergens is helpful too. So minimizing rugs and carpeting and drapery in the space, stuffed animals in your kids' rooms, those collect a lot of allergens on them. So try to get them out of there if you can, or at least clean them frequently.
What about those filters for your furnace?
HEPA filters, absolutely. Using HEPA filters can help as well. It helps filter out those allergens. When you clean your space, you want to make sure that the allergy sufferer is not in that space for about an hour after you clean it. When you vacuum and you dust, you see lots of things in the space, like, in the air, it looks more dirty than it was before. If you walk into that area, you're going to inhale those allergens and have more of a response. So stay out of the space you clean for a good hour afterwards. And finally, for those that are allergic to dust mites, which is a super common allergen, basically little insects, little critters that live all over us and feed on dead skin cells. So super gross. They live in our mattresses, our pillows, our drapery. If you use a pillow cover or a mattress cover that's sensitive to allergens or protected against allergens, you won't be inhaling those all night long, which can help as well.
Good to know.
Good to know, indeed. Thank you, Dr. Dina, for those
Thanks for having me.
on getting through allergy season. And visit our website for more information. Don't go anywhere because we'll be right back.